Uh, Namaste and welcome all of you. I am Tumla Shrestha, PhD Scholar at Institute of Medicine, University, Nepal. Today I am going to present my research study findings regarding preterm infant practice of nurses and neonatal care units of selected hospitals of Nepal. And moving to the background and rationale of this study, preterm birth is the biological risk for the morbidity, mortality, and long-term loss of human potential. And in its incidence in Nepal is about 9.3%, which is slightly lower than global 8.6%. And preterm birth incidence is increasing trend. And studies has reported high prevalence of preterm birth on infants in neonatal care units, as well as higher mortality among them in neonatal care units. And therefore, they require special and meticulous care and treatment in neonatal care units for survival and development. And this kind of preterm infant care in neonatal care unit is collaborative and team effort, and nurses are the main carrier to provide quality care to them. And nurses providing care and support to them influenced by various factors. And Nepal's Newborn Action Plan, NEAP, which is the strategic plan for newborn services in Nepal, has emphasized for the scaling of the facility-based newborn care services, and it has focused on quality care. And some informations are available regarding prevalence, morbidity, mortality, but paucity of information are available about care status in Nepalese context. Therefore, study was conducted to assess the preterm infant care practice status in Nepalese context, so that findings might be useful for the enhancement of the care practices in the context of Nepal. And the objective of the study was to find out the preterm infant care practice of nurses in neonatal care units of selected hospitals of Nepal. And the study was cross-sectional survey and conducted in neonatal care units of public tertiary hospitals of Nepal, having more than 8 neonatal beds and having both special newborn care units and neonatal care unit services. And total 6 hospitals were selected randomly from 2 clusters for the study. 3 out of 4 hospitals from Kathmandu Valley and 3 out of 8 hospitals from outside the valley. And continuing methodology, the population of the study was nurses working in neonatal care units, and nurses having working experience in neonatal care units for more than 6 months were included in the study, and total 102 nurses were recruited for the study using total immunization sampling technique. And the instrument for data collection was self-administered questionnaire on preterm infant care practice of nurses, and instrument contained 5 domains, 5 subdomains, and 43 items. And nurses had to respond on 5-point rating scale on never to always practice within 1 month of their practice. And for the validity of the instrument, various measures were used, including review and relevancy scoring by subject matter and research experts, and content validity index scores were calculated, and it was more than 0.79 for items and more than 0.9 for this scale. And for the reliability, various measures were used, including pre-testing of the instrument among 30 nurses, and internal consistency alpha Cronbach alpha score was calculated, and item was value of Cronbach alpha was more than 0.79, and overall scale was more than 0.9. And regarding ethical consideration, ethical approval for the study was obtained from the Institutional Research Committee of Institute of Medicine and Nepal Health Research Council. And also approval was taken from the study settings, and administrative permission was obtained from the study settings, as well as written informed consent was taken from the participants with full explanation about the study and their role. Regarding data collection, self-administered questionnaire was administered among the nurses in the presence of researchers in different groups, and obtained data was analyzed using descriptive and inferential statistics. Chi-square non-parametric tests like chi-square and logistic regression model was used as the data was found non-normal. Now, findings of the study. Table 1 about demographic and personal characteristics of the nurses shows that majority of nurses were less than 30 years of age group, and 57.8% nurses had bachelor nursing education, and 68.6% had less than 3 years of experience in neonatal care units, and most of the nurses were staff nurses. And this table 2 shows that overall care practice readiness score was 2.0, which indicates overall good practice of the nurses. And domain was practice shows that their highest readiness score was for daily supportive care, and the least score was for pain management. It means pain management was inadequate among them. And sub-scale readiness scores show that safe oxygen administration had the highest readiness score, followed by thermal care, and positioning handling has the least readiness scores. And the table for about correlation among selected variables shows that some variables have weak but significant relationship, like age was significantly correlated with educational status, designation, and work experience. However, correlation value was low. And regarding association of preterm infant care practice with selected variables, the year of experience, training, and nurse patient ratio was significantly associated with care practice. And having near standard nurse patient ratio was 16 times more likely to have better practice than having below standard nurse patient ratio. Similarly, having training would have 3.8 times more likely to have better practice than not having training. Table 6 shows that having near standard nurse patient ratio would have 18.5 times more likely to have better practice than than having below standard nurse patient ratio. Similarly, having neonatal training have 5 times more chance of having better practice than not having training. And now discussion. Some studies, Solomon et al. 2017 and Valzade et al. 2013 have similar findings like this study for the domain-wise practice. However, overall practice ministers were little different. And Godarji et al. Had shown better sleep promotion and pain management practice than this study. Likewise, regarding factor influencing care practice, workload and training is the associated factor was identified by these studies, various studies, and similar finding was in these studies also. And then et al. 2014 had explored some more factors like need of support and implementation of clinical center care for better practice. The study was done in China. And now conclusion. According to finding of the study, it is concluded that nurses had good practice of overall preterm infant care practice, though lacking in some developmental supportive care components. And pain management was the most lacking practice area. And practice had significant association with working experience, receiving neonatal training, and nurse patient ratio. And having near standard nurse patient ratio and neonatal training had higher probability of improving neonatal preterm infant care practice than not having. And now recommendation. Based on the findings of this study and other related study in this field, the study has some recommendation for the nursing practice. Nurses need to practice consistently developmental supportive care in their regular practice of neonatal nursing care. And pain assessment and management should be an essential part of nursing care for preterm infant care as well as other infants in neonatal care units. Nurses should have continued professional developmental opportunities for updated care practice in neonatal care units. And there should be a standard nurse patient ratio for standard practice, because in present nurse patient ratio, it is impossible to provide standard developmental supportive care as well as parental support and parental involvement in neonatal care practice. And there are various differences for this study, which is attached in another file. Thank you so much, all of you, for listening